Hello, this is Kim McAllister, and today we're going to talk about understanding theory and research frameworks. We have a set of objectives that you can read on your handouts. So we're going to talk first about what is a theory. A theory is made up of concepts and also relational statements, and so the theory tries to describe or give the rationale for the relationship between the different concepts. It's based on ideas and knowledge from science, and research is based on a theory. So when you have a theory, you then conduct research to validate the theory. And research will help answer that question of whether or not your theory was correct. So a framework explains the theory or parts of the theory. You could have a very broad, what we call grand theory, and so then you're going to use a framework to describe just a small portion of that. If it's a mid-range theory, something smaller, then you may be looking at a research study that focuses on more of the theory. So the framework should be stated. It should be clearly stated in the research report. Sometimes it isn't. It's what's considered implicit. In other words, it's implied in the discussion and description of the study. But a good research study has the framework clearly identified. Conceptual models are important because they're more abstract. They're more abstract than theories, but they're used to explain the phenomena of interest, and they also give more philosophy behind the theory. They're not something that can be tested by research. So an example of a conceptual model might be the patient comfort or nursing satisfaction. These are very broad things, and they can be used then to guide further studies. So the sources that are used for conceptual definition could be existing theoretical works. So they can be used if the proposition from the theory is being tested. You always want to provide them when they're available, and you can find them by searching the literature. They should always be directly quoted, and they should be cited if they have been discussed in the literature. So to find sources of conceptual definitions, as I said, you can search the literature for previous studies. You can also look for publications describing instrument development. Perhaps the study you're conducting is using an instrument such as a survey or some type of tool that has been used in other studies. You should be able to find the conceptual definitions in the literature that discusses the development of that tool. You also may be able to find it just generally in the literature, and you can also find it by doing a concept analysis. So a theory is going to have concepts, and these are abstractly describing an object, an idea, or a phenomenon. You're going to have a definition of those concepts. So if you are discussing a concept in your theory, you need to have definite definitions of those concepts. You need to have a relational statement. Why does this impact that? Or why does this make that better? And it's also helpful to draw out a model that will help people understand it. And I'll show you what I mean. If you look in your book, you have some critiques of research studies. And this is a model. So this is a framework of talking about social environmental factors affecting rehospitalization of Medicare patients. And you can see that they have several concepts there. And here you have concepts of health status, functionability, cognitive function, and so on. And so you want to be sure that you list those and then define those in your study. A mid-range study is less narrow in scope than a conceptual model. In nursing, what may help you kind of connect this together, the conceptual models such as Orem self-care, we call those nursing grand theories because they're bigger than a mid-range theory. So Watson's theory of caring, Roy's adaptation model, these are grand theories. A mid-range theory is going to be less abstract than saying something such as caring or self-care or adaptation. And these can sometimes be developed through studies, such as a qualitative study, where you're looking at discovering themes. This will help you build that mid-range theory. So how do we use practice and intervention theories? Sometimes nurses have a hard time, conceptualizing and understanding what nursing theory is. You go to work, you give the best care that you can for your patient, and then you go home at the end of the day. If you haven't really taken a close look at the nursing theories, you may not realize where theory comes into place. But whatever program that you studied for your initial licensure had a main theory, a nursing theory, or even more than one theory that they focused their program, the development of their curriculum upon, and that will have influenced how you care for your patients. So if you can, go back and look at your initial nursing program and see if you can capture that. Also, take a look at some of the nursing theories that you've studied and look at the way that they define nursing and the way that they define care and patient care. Look at the concepts of those theories and decide which best defines you. My personal theory is Orem self-care theory. With Orem self-care, you're trying to get the patient to the maximum level of functioning. I've spent a lot of my practice in public health and in community health. I've been in patients' homes, worked a lot with patients with chronic conditions. And so my focus has always been on restoring them to the maximum level of function. So this is how you would utilize intervention with it. So frameworks are what explain the theory. This is what your theory hangs on. This helps to start to bring that theory from this abstract, down into a concrete thing that you can look at, analyze, and begin to work with. And your framework is going to help lead you to your hypothesis. And it's very helpful when you're developing a framework to draw a model like they did here. This is the framework, but it's expressed in a model. And this makes it easy to see. Like with your patient with a chronic condition, they have some type of clinical status score based on what their illness is. Think about diabetes. That requires a huge amount of self-care. And then think about the functional ability of your patient. And so you want to subtract the therapeutic demand. You want to take away what they are or aren't able to do. And then that will lead to rehospitalization. So for going back to your patient with diabetes, let's say they're blind or they have a visual impairment and they can't draw up their insulin, they can't see the numbers on their pen, and maybe somebody could set that pen for them, but maybe they don't have the manual dexterity in order to attach a new needle every time. So this could impact their self-care deficit, to kind of get an idea of what we're talking about here. This is a framework of trait anger. This is also in your text. And you can see that they drew a model to explain the framework where trait anger can increase blood pressure. These are the different patterns of anger expression, and then stress. All of these things together can impact blood pressure. So what frameworks might be used for a physiological study? It might be something based on physiology or pathophysiology. And these theoretical relationships may be fact rather than theory. So we may be using things that we actually know from the way that the body works, such as obesity causes an increase in heart disease. So then you can use propositions and develop those for your hypothesis, and they can be based on these principles. So frameworks in mid-range theories are going to have a limited scope. They're going to have fewer concepts because remember, the mid-range theory is more focused, it's less broad. They still have to be sufficiently generalized to have application to a wider population, and you're going to be able to actually test these. So this would be like if you're doing a survey on, or doing maybe a retrospective study looking at how this particular type of patient education versus that impacted the outcome of the patient. So frameworks are a lot of times frameworks are derived from your qualitative study. Remember, with qualitative research, you're looking at concepts, you're looking at thoughts and feelings, you're sitting down and searching for themes, you're having an interview with the patient and exploring common themes and so forth. And so by pulling that information in, then you can use that to develop a framework. And then that framework may be used to construct and carry out quantitative research. A lot of times researchers who are trying to search for a particular problem that maybe they can't find a lot of previous study, there's not a lot of support in the literature, they will carry out a qualitative study before they build their hypothesis. So few of our conceptual models in nursing come from research. This is why research is such a big deal in nursing education. We're trying to develop more research and more research studies to test out these concepts in nursing. So you can have problems with frameworks. You may have used an inappropriate framework. In other words, the framework that you describe using has very little application or doesn't really support your study. Your framework can be disconnected in that you can't find a way to fully connect the concepts and the relations to the framework. Some researchers will use multiple frameworks. A lot of times this is someone who's really wanting to carry out about 3 or 4 experiments, and I know some of you have several different ideas for your research project, so you can really relate to that. So you need to narrow it down to one framework. If you're looking at more than one framework, you probably don't have your study question focused down. And then we have the unidentified framework, where someone really just kind of didn't really bother to figure one out, or it's more implied. So it's very important, in order to have a good research study, again, build your framework, identify your framework. So to critically appraise a study, you want to look back and see that all of these things that we've talked about, all these components are present. The concepts are linked to the variables. So your independent and your dependent variable have some relation to the concepts. And those concepts can be found in the hypothesis or your research question or somewhere in the objectives of your research. The hypothesis, research question, and or objectives are tested statistically. So somehow in your study, you are providing statistics, and you can provide statistics in a qualitative study. You're looking at different themes or ideas or questions or problems that come up in your conversations or in your surveys, and those can be put into a statistical software, and you can actually come up with statistical results. And so then your hypothesis, your research questions are going to emerge from the framework, from what you propose in the framework. You want to look for comments that connect the findings to specific elements of the framework. So when you're looking at the conclusion of the study, there should be something in the conclusion or in the findings that point back to your research framework. So look at your framework and maybe jot it down, and then look at the conclusions of the study and make sure that the results reflect back on that. And then you want to find things that say, yeah, the study, our results confirm our framework, or they didn't. It's not a bad study if they don't prove their hypothesis. It just means they prove the null rather than the true hypothesis. And that's still good, effective research. Also, you want to look at whether or not the findings are consistent with the objectives and so forth in the study. If they're not consistent, look back at the methodology. Was there something wrong with the way the study was conducted that it couldn't test it? And then look at if the consistency of the findings with other studies using the same framework. So you can do a search for the different frameworks and pull up all the studies that use that same framework and look at their findings. Were the findings consistent? Good research should be replicated. We should be able to conduct your study here and here and here and here and have consistent results. Okay, I hope you've enjoyed this explanation of theory and framework.